Thanks to advances in dental imaging technologies, it is now possible for you to make clinical decisions based on information that simply was not available in the past. X Mind Trium, a cone beam computed tomography system from medical imaging expert Acteon, is an excellent example of this. Combining cutting-edge 3D imaging with instant volume measurement and bone density assessment, X Mind Trium facilitates implantology, endodontic diagnoses, and more. To understand why so many clinicians are excited about X Mind Trium, let's start by looking at how it is used in implantology. Because high-quality bone support is vital for implant success, having a reliable assessment of bone quality improves implant success rates. X Mind Trium identifies this support, measures the bone volume, and assesses the bone density all around the implant with just one click. It offers high-precision 3D imaging of the anatomy from a single scan and provides a full understanding of the patient's jaw. The X Mind Trium assists the diagnosis, simplifies treatment planning, supports surgical treatment and post-procedure follow-up, and facilitates successful osseointegration of the implant. For example, X Mind Trium enables you to locate and trace the mandibular canal precisely, and then get a measurement of the distance between the nerve and the implant. The color-coded 3D images make it easy for you to assess bone density. Low-density bone is shown in red, and high-density areas are indicated in green. Once you have assessed the bone, you can use 3D modeling to choose the size and shape of the implants in proportion to the patient's morphology, either based on a substantial and scalable implant library, or by putting the crown in place and using it as a positioning guide. In the field of endodontics, the extremely detailed three-dimensional images that X Mind Trium creates contribute significantly to the accuracy of endodontic analyses, enabling you to provide more accurate diagnosis. These images provide very precise anatomical information, such as the anatomy of dental roots, the working length of the tooth, and the apex-sinus relationship. You'll also find the X Mind Trium images useful in diagnosing fractures and apical lesions and highlighting potential risks prior to surgery. In fact, for high-risk situations, the additional information that X Mind Trium's 3D images provide, compared to traditional 2D imaging, can be critically important to an accurate diagnosis and the right course of treatment. In addition to these applications for implantology and endodontics, X Mind Trium responds to the needs of specialists and general practitioners in the diagnosis of pathologies related to periodontics, orthodontics, and maxillofacial surgery. Applications include evaluating a detailed morphology of the bone tissue, diagnosing infectious diseases, exploring the maxillary sinuses, determining the protocol for extracting included teeth, conducting an orthodontic assessment, helping diagnose TMJ disorders, and more. Regardless of the application, you'll appreciate the exceptional quality and consistency of the images that the X Mind Trium cone beam computed tomography system provides. The presentation of bone material in the maxillofacial skeleton is accurate and perfectly uniform for all viewing axes. Even better, these images are all presented at 75 micrometers, the best resolution available on the market today. To further enhance image clarity, the X Mind Trium system is equipped with a dynamic artifact reduction filter that eliminates the streaks and dark bands that are typically caused by the presence of metal. As you can see in these with filter and without filter images, the filter makes a significant difference. While the X Mind Trium's adapted spatial resolution provides a perfect view and extremely clear images, its use of pulse mode scanning, high-sensitivity CMOS sensors, and small fields of view all combine to allow for a notable reduction in X-ray doses. When selecting the field of view, simply choose the one that will let you zero in on the region of interest for the target diagnosis. A 110 by 80 mm field of view, for example, will show you the full dentition, mandibular canal, and lower sinuses, while a 40 by 40 mm field of view is ideal for endodontic diagnosis and treatment. A variety of other field of view options are available as well, including a 60 by 60 mm and 80 by 80 mm.